All right. Good morning. Welcome to our June practitioner community talk. Today we have Dr. Isabel Perez, and she's going to be presenting on a very interesting and informative topic. And it's going to be extremely useful for anyone who's tuning in to listen very carefully to all the information that she's going to share today, because a lot of times problems occur because we are not fully informed. We are unaware of simple things that are happening, our own choices that can impact some of our health parameters. And listening in will be extremely helpful to become aware and become connected with those things in our daily lives. And hopefully, we can do things a little more in an informed manner so that we are not harming our body unknowingly in ignorance. So, this is going to be part of our ongoing community health education effort, where anybody in the community today, online or later through the YouTube video, can continue to learn about these important things about health and wellness. So before I give over the dais to Dr. Isabel, I'm going to briefly introduce the organization that is hosting the talk today, which is Wholistic Health Alliance. Now, Wholistic Health Alliance is a 501c3 nonprofit. It is nationally launched, and we have a practitioner side of things and project side of things. So practitioner side of things is to do with our directory. It's extremely nominal to join Holistic Health Alliance. So any practitioner that is tuning in and is doing any type of holistic work, is trained in any type of holistic modality, can become a practitioner member. And if you are not trained in anything holistic, but are a supporter, you can just sign up as a Holistic Health Alliance ally. So, we are trying to increase the holistic community's footprint. And that is why we have this platform. It's extremely nominal to join. If you are a company or an institution, you can join as an institutional member. Once again, the fee is extremely nominal. The goal is to really bring all like-minded people together and increase the health and wellness footprint as against the sickness footprint. So this is a small, humble effort in that direction. As far as projects are concerned, we do these kind of monthly free educational talks. We do monthly dinner meetings. Now, post-COVID, we have started that again. So we meet in person, and hopefully we can replicate that practice to all our state chapters as well. And the most important project that I would like to share with all of you very briefly is the Youth Brigade project, where we are beginning to engage youth in conversations around health. One of the major projects that we have involved youth in, so this is a quick, are you all able to see the Youth Brigade flyer?
Yes.
Okay. So this is a screenshot of, you can say, a snapshot of our call out to youth in your family, in your own family, in your extended family. And you can see if we engage youth in conversations around health today, we are going to have a healthy world tomorrow for sure. So we have to start early, and especially because awareness around health parameters is so low. The value of even sleeping properly, the value of even breathing properly, stress mitigation, stress management, which we all know that in the formative years, the youth can really get impacted if they know not. So this is a humble effort to bring in more youth in this fold. And I'm extremely proud to share with all of you, whoever is listening in, that at this time we have, under our Teen Mental Health Initiative project, we have 50 plus school chapters across 8 states in less than 3 years now. We are just 2+ years. And we have recently started another youth brigade project, which is called Fooditude, changing attitudes around food by helping youth to learn about reading labels, about paying attention to what they're putting on their plate, how much they are putting, when they are putting, etc. So these are some of the projects. I would encourage anyone who is tuning in to check out our website, www.wholistichealthalliance.org, and consider joining us either as a practitioner or as an ally. Again, the website is www.wholistichealthalliance.org, where holistic starts with a W. That is the differentiator. So www.wholistichealthalliance.org is the website. Now, with that, I would like to invite Dr. Isabel to take over, introduce herself, and share with us all the wonderful things that she's prepared to share with us today.
Thank you. Thank you, Dr. Prativa. I'm going to share the screen and I'll introduce myself. So are you guys seeing the screen? Okay. So then welcome to this webinar, this Nurturing Mind, Body, and Smile, Harnessing the Power Within. So today we'll be talking about the emotional well-being and dental health, the mind-body connection, empowering your smile and cultivating balance in life, self-care for optimal well-being. So I am Dr. Isabel Perez. I am a biological dentist with a PhD in integrative medicine. So what is that biological dentist? A lot of people don't know about it, but it is also known as an integrative or holistic dentist, where we view the mouth and the body as an interconnected part. We look beyond the individual teeth and we try to understand the causes of symptoms, the root cause of what the patient is experiencing. And the difference is that traditional dentistry, they only focus on tooth-related problems. I was born in Colombia, South America. I am a mother of a twin 17-year-old girls. I'm a Reiki master, emotion and body code, dental and biological decoding practitioner, and I'm founder of Biodental Health. For me, our mouth is the gateway to health and a mirror of our emotions. I am a dedicated professional that wants to inspire others, and I would like to unravel that intricate mouth emotion connection and guide people and individuals to have a profound well-being. That's my goal. So did you know that the journey to wellness starts in the oral cavity? We start eating to be able to nurture our body. Using our mouth, we breathe. There is a lot of connections with the oral cavity that allows us to be having overall well-being, overall health. So oral health is a crucial role. It plays a crucial role in our well-being, in our life. In my mind, to be able to achieve health and longevity, we need to start with oral health. And why is that? It's because there is a big connection between what's happening in the mouth and what happens in the rest of the body. When I do the biodental health analysis, we are able to see imbalances in the body, in the different organs, different systems. Then also we can find emotional and psychological aspects related that are showing in the mouth, related with what's happening with our present life, but also according to epigenetics, the study that scientists have been doing, they show that what happened to our ancestors can affect us as well. If you think about it, when our mother was in her mother's womb, so in our grandmother, her eggs were inside of her, and now you are here. So you are sharing all this information, whatever was happening in your grandmother's life, that information is stored in our cells. There is a scientist that I love, and she wrote a book, the Molecules of Emotion. Her name is Candace Pert. And she found that every single cell in our body has receptors for emotions. So it has receptors for positive emotions, and it has receptors for negative emotions. So if we are experiencing a lot of negative emotions, then all those receptors are going to be filled with that. And we can see a lot of information in our biodental health analysis. The other important part is the project and purpose, that project that our parents had at a subconscious level for us, something that they created even before our conception. So what was happening in our parents' life affected our personality, or affects our personality in the present moment. Knowing that and just uncovering all this information can help us move forward in life. Also having a positive thinking. What Dr. Pratibha said is the nutrition is super important. Just what it is that you're putting in your mouth is going to make a difference in your body. Exercise, but then also the transgenerational health, that information that comes from our ancestors. And we can just get to that information through our body. Then also, if we work on all this, is a long journey, this wellness road, it can be a little curvy at times. And the body is always sending us messages, but we don't understand those messages. So my goal is for everybody to start listening to their body, start understanding what it is that is trying to communicate. And then we see how the mind and the body are deeply intertwined. They are having an intricate connection. When we embrace that connection, we open doors to a deeper understanding of wellness. For example, stress, unresolved emotions, negative thoughts can create a big change in our body. There is a study that is called PNEI, the psychological, neurological, endocrine, and immune system. When all these systems are connected, and the psychological includes the thoughts, the emotions, when they're all in balance, our body is in harmony and we achieve health and well-being. But if one of those is not in balance, we start having problems. And the mind, our thoughts, our emotions, our negative experiences, they play a big role in our health. If we start thinking about how we respond when we are under stress, we're going to see how the body starts sending us messages. We start having, our stomach gets all tight and contracted. We get nauseous. Sometimes our hands start sweating. So there is a physical reaction when we are experiencing some negative thoughts or stress. So I would like to do an exercise, and maybe some of you have done this, but then let's go a little bit deeper. And then we're going to be, just if you want, you can close your eyes, or you can just lower your eyesight. And then we're going to start just getting comfortable in our seat. Then I want you to breathe. Then I want you to start visualizing a lemon. You're going to see that lemon. You're going to see the color, the bright color. You're going to feel the texture. And then I want you to imagine taking a knife and cutting the lemon in half. Just visualize that juice of the lemon, the aroma that is filling the air, and you're just smelling that lemon. Just visualize that you're bringing one half of the lemon to your mouth. Then you're going to picture yourself biting this lemon. You're going to feel that tartness and the texture in your mouth. You're going to pay attention to any sensation that comes to the surface. Maybe an emotion, maybe an image. A lot of the times, the things that we taste, the food that we eat, is connected to an event, is connected to an emotion. So I want you to start visualizing that you're eating this lemon, and you're going to start noticing how, even though you are not actually eating the lemon, your mouth starts salivating. You experience physical reactions. I want you to take your time, enjoy that lemon. And then when you're ready, you can just open your eyes. I just love this exercise because it's a very simple way to see how the mind and the body are connected. That even if we are not having the actual lemon in our hands, our body is responding to it. There was a study in 2019, and I want people, if you can write down, if you experience that salivation or what you experience, it will be nice to know. There was a study published in 2019 where they found that people that were experiencing bruxism is when you clench or grind your teeth, that's the name for clenching or grinding of the teeth, they have higher levels of cortisol, which is a hormone associated with stress. And they also found that there was a big connection between the nervous system and the bruxism. So then it demonstrates that whole relationship, that the body is connected, not only just individual parts functioning separately. There is a whole connection between what's happening in our body. Then they also found in this study that before people were clenching or grinding their teeth, they started to increase the brain activity, and then the heart rate changed before clenching their teeth. So there was a nervous system was activated. There was something that was sending signals to the brain that started changing the heart rate and started lowering or actually increasing that heart rate and raising the cortisol levels. There's a big connection between what's happening in your mouth and what's happening in the rest of the body. Just look at this image. If you look at that, we have that tooth, and then we have the gums around it. Well, if you have a lot of bacteria, a lot of negative bacteria in that area, that is going to be going through the bloodstream to your body. They have done studies where they found that there is a big correlation when you have periodontal disease, which is the inflammation of your gums, and also bone loss, that combination, a more chronic inflammation in your body and your gums, that is associated with some patients with Alzheimer's disease. They have found one bacteria that we find in patients with periodontal disease, the same bacteria in patients with Alzheimer's disease in their brain. They have associated periodontal disease with cardiovascular problems, and then also with respiratory problems, and then even with pregnant women, preterm babies, or early deliveries. So there is a big connection between the mouth and the body. Then what it is that the body is trying to communicate through our mouth? Well, we find it not only on that inflammation on the gums, but also on the tongue. Traditional Chinese medicine has found that certain areas in our tongue represent what's happening or the health of different organs. So for example, if the tip of the tongue is more inflamed or red, and I've seen that a lot of the times patients come and the tip of the tongue is red. Well, that's representing the heart. And it can be the physical heart, or it can be the emotional heart. So if you're having a heartache, that part of your tongue can be affected, or you can start having some changes. If you're having some hormonal imbalances, we can see that in our mouth. A lot of dry mouth can be a relationship with stress, but that also with hormonal imbalances. And then one of the things that is really important is that connection of the teeth with these organs. And is every single tooth is connected with a meridian. A meridian is like a pathway of energy where we have the chi, the life force of our life, is running through those meridians, through those pathways. And if there is a tooth that is having issues, it can block that meridian. So if, for example, and that happens a lot with teeth that are root canal, when the root canal is done, it's just there is no more nerve on the tooth. So that circulation is interfered. That circulation is blocked. So you could have some problems with that organ that is connected with that meridian and that tooth. So that energy flow can be affected. So that's why it's important to know what's happening at an emotional level and then connecting it with what's happening in the mouth. What are the signs that you're seeing in your mouth? And empowering your smile. Your teeth hold valuable information. They are the window into your overall well-being. They store information about our ancestors. So smiling has a big impact in our mood and our overall well-being. Did you know that kids smile about 400 times a day? 400 times a day. And you see how something happens to them and they just start smiling. And it's a bright light in their eyes. And adults, we only smile between 40 and 50 times a day. Compare that, 400 for a kid, 40 to 50 times a day. And what they have found is that when you smile, your blood pressure slows down. It gets lower. So lower blood pressure, lower heart rate, the stress gets improved. And even if you're faking the smile, and this is a great thing to do when you're stressed, when you're having a really bad time, when you're upset, in my case, with your kids, and I'm just frustrated because they're not doing what they need to do or what they're supposed to do, and their priorities are completely wrong. So if you just put a smile in your face, what's happening? All those muscles, the smiling muscles, are activated. It sends a signal to your brain. Your brain thinks, oh, she's smiling. We need to start releasing those neurotransmitters that are going to be like the dopamine, the feel-good neurotransmitters. It's going to make you feel good. The more you're faking the smile, the more changes are happening in your nervous system, the more changes are happening in your brain. Those neurotransmitters are going to get activated. Even the endorphins get activated. The endorphins are the painkillers, the natural painkillers in our body. So if you're having pain, you start faking that smile, it's possible that the pain is going to improve. And then also all these neurotransmitters are going to start changing your mood. So smiling is also contagious. So if you're around people and you start smiling, people smile back at you. So it is a good way to, and when someone is sad and you give them a smile, it is going to change their life. It's going to change that moment for them. It's going to brighten their day and improve their mood. So I would like to invite you to learn a little more about this connection between the smiling, the bruxism, the clenching, but then even more about how can we improve and empower our smile with a healthy oral cavity. I have a free ebook on my website. So there is a little code in here that you can scan and you can just access it and go to my website. You can take a look at that free ebook because you're going to see some hidden secrets that your mouth has for you. And then just start learning about them. Start learning about why is it that you're struggling in your relationships, for example. That information is stored in your mouth. Or why are you having issues with work? Why is it that you start something and you never end it? So that information is stored in your teeth. This world is fascinating. And I'm so passionate that I would love everybody to learn about it because we can save our health a lot if we start changing things, if we start understanding exactly what it is that the body's trying to say. So achieving balance requires a holistic approach to health, which includes oral health. So we want to maintain overall harmony and vitality. And this includes avoiding toxins, such as the toxins that you use on your toothpaste, for example. There is a lot of chemicals in toothpaste that are not really beneficial. Fluoride, for example, or mercury, if you have amalgam fillings or mercury fillings, they have negative effects on our health due to their neurotoxicity. There is a video on YouTube that I highly recommend to watch, the effects of mercury in the brain and how the neurons, that the ending of the neurons, they start disintegrating. There is a damage on that ending, so the connections cannot happen, and this is because of the mercury and that toxicity in the neurons, nervous system, and our neurons. So emotions are a big part of it. We want to make sure that we have a good balance of mind, body, and soul. Maintaining harmony in these areas is optimal for health and balance. So it's important to identify those emotional conflicts that may exist even at a subconscious level, things that happened to us when we were 7 years old, 5 years old. It stayed in our subconscious mind. Sometimes even it blocks that event, so we don't remember, but it stays in our subconscious mind, and it reflects in our body. It's important to have a community. A sense of community is vital for our good health. It promotes a sense of belonging, support, and connection, which has positive effects on our physical, our mental, and our emotional health. It decreases stress, enhances the immune function, and encourages a healthful behavior. So self-care is very important. Just brushing your teeth at least twice a day, flossing, and then visiting your dentist at least every 4 to 6 months. Sometimes even 4 months is too long for some people. So if there is a lot of bleeding when you floss, or if there is a lot of inflammation on your gums, or if there is recession, it might be a good idea to see your dentist more frequently. So let's explore practices that nurture other than brushing, flossing. That's critical. But practices that nurture your mind, your body, and your spirit. So let's include exercise, mindfulness, and meditation is really important. Adequate sleep and healthy nutrition. Just as pure as possible, avoiding chemicals. It is really important. And then just relaxation and enjoying life. It is really a good idea. There's a lot of information on my website about what are the most ideal habits for you to have healthy mouth that will help your health, your overall health as well. So in conclusion, nurturing our mind, our body, and smile is essential for leading a happy and fulfilling life. Cultivating a positive mindset, prioritizing physical health and self-care, harnessing the power of a smile. Just don't forget to smile. It's so simple. With that, we can improve our overall well-being and live our best lives. So I encourage you to take what you learned today and start implementing these simple practices, but you need to do those consistently. Just eating healthy one day is not going to help. We need to be consistent with what we are doing, the habits that we have. Remember, small changes can make a big difference. So I want to share this image with you. I want to thank you. I hope I have sparked your curiosity to explore further into this captivating world of understanding messages that are expressed by our bodies and mouths. I really appreciate your presence here and extend an invitation to join me on my YouTube channel, where you can find more insightful content. There I do interviews for practitioners, health practitioners that give you tips and recommendations to improve your health. And then also, I want to invite you to our soulful sessions every Friday at 10 a.m. Pacific time, where we go deeper into this cave, deeper into that subconscious mind, deeper into what it is that I'm doing things right, but I'm still not feeling well. I'm still not healthy. I'm still having issues at a physical level or emotional level. And we'll see how going deep into this information that the body has for us, we can find a lot of help, a lot of relief in our health. So I'm passionate about connecting that relationship between the oral health and our emotions to achieve well-being. So I want to invite you to embark on this journey with me and discover it together. So this is my information. And again, you can just use that QR code to go into all my information. And if you guys have any questions, I'm open to answer them. Yes, Susan.
I had a question. First, I couldn't see if you posted something with your QR code, or I couldn't see it. I don't think it came up.
I'll post it on the chat. Because if you are in the phone, I don't think you can do.
Oh, okay.
Do that,
That's
right?
right.
So
That's
I'll
I'll
post it here. I wanted to ask you, Susan, did you get any salivation when you did the exercise?
I did, for sure. I
Isn't
certainly
it
did.
incredible?
It is incredible. It's
I know.
crazy.
And it's the same thing as when we are, for example, watching a movie.
Yes.
And we start getting emotional, and we're not even, it's not even our life. And then we start tearing. I do that quite often.
It's true. It is.
It is incredible.
It is. And for that reason, I don't like to watch sad movies or scary movies. I'm not a fan. No, because I get too emotional.
Yeah. They did a study where about when you're talking about that, the sad movies and smiling, right? So they did a study on baseball players where they checked a picture that they took a long time ago, and the baseball players that were smiling on that picture, they had a longer lifespan. They check, and the patients or the people that were there on the picture that were not smiling, they have a shorter lifespan. So the average, I believe, was 79 years old. The ones that were not smiling, it was like 72.
Oh, wow. That's interesting.
I take that, a few years.
Yes.
But then if on top of that, you're increasing your immune system, you're balancing your nervous system, those are all amazing benefits. So if people has high cortisol levels, just start smiling more. Let's try to catch up with the kids, see if we can do 400 times a day.
Not only that, smiling is contagious.
It is.
You're spreading.
Correct.
Spreading the health.
Yes, it is.
True. Yes.
Look at
this. Is that a study?
I'm sorry. Yes.
Sorry. Is that a study that you mentioned that the 72-year-old, 79?
Yes, I can share it with you.
Please.
Absolutely.
I would love to. Oh, we can't push this thought enough. I mean, it's such a great presentation, Dr. Isabel, because a dentist presenting about these concepts is really, I would say, pioneering, because these are such neglected areas. People do not think about how powerful just stretching your lips can be.
Exactly.
And even if you fake it till you make it, that's also fine. I mean, I am a compulsive smiler. I don't know, it's there in my DNA. I cannot have this face. Lucky for me, but everybody can do it. Yes. Thank you, Dr. June, for joining. Thank you.
I did have a quick question.
Yes.
For something that has always been my curiosity, for I know that they say root canals are not always the best, but there doesn't seem to be another alternative for a root canal. So are there any recommendations that you might have for people that have had root canals, or it just is what it is and you just accept it for the rest of your life for the most part?
No, there is a lot of information, and you can follow me on Instagram. I usually post things in there about root canals. You know, root canals, imagine the tooth inside is like a sponge, a lot of little holes, a lot of tubules that go from the nerve to the outside of the tooth. So if you have an infected root canal, the whole tooth can have bacteria inside those tubules. A lot of root canal teeth are okay and there is no symptoms. The majority of them don't have any symptoms. And the only way to see if there is an infection is with a CT scan, a 3D image. Because on a regular x-ray, the x-rays that dentists take, the conventional dentists take, you don't see that. And I posted something on Instagram where you can see a regular x-ray compared to a CT scan image. And there is completely different view of that. So if you are having an infected root canal, I will highly recommend you to remove that, because it is blocking, as I said, the meridian on that tooth, or that meridian that goes to, for example, if that tooth is connected to the stomach or to the liver, your liver can be having problems. And saving that tooth full of bacteria that is harming the rest of your body. And not only that, is your immune system goes to try to help that infection. So your immune system, all this army is going to fight that infection, and is taking the energy from other parts of your body that also need attention. So unfortunately, for infected root canals, I would not recommend to go and do a retreat. A lot of people go and do a retreat, do surgeries. That infection is going to come back, and it's just harming your body, harming your immune system. So yes, if you do have a brand new tooth, let's say you just had an accident and you hit the tooth, the nerve is inflamed. Having a well done root canal, trying to avoid all this bacteria spreading in through those pores, into those holes, that can be okay if it's done correctly. And done correctly means that you are making sure that you're cleaning and irrigating those canals really well. There is a device that is called gentle wave. So and it has to be done by a specialist. I would not recommend. There's dentists that do this really well, but the specialists do this all day long, every day. They have a lot of practice. Because if there is a missed canal, then the bacteria is going to go there. So having it done by a specialist using gentle wave, and if they have ozone, that will be even better. Ozone is a gas that goes into all these areas and disinfects, removes bacteria, virus, even fungi. We use ozone a lot in our dental practice. As a biological dentist, we try to create an environment that is better for the body. So doing something like that will be okay. Monitoring your root canals will be okay. Will be ideal, actually. With a CT, I've seen many patients that they come from their dentist. They have regular cleanings. They have checkups every 6 months. When they come to our office, we take a CT and every new patient gets a CT. It's incredible what we see. And the patients are feeling the consequences in their body. They're saying, I have low energy, I have brain fog, I'm fatigued. My doctors, I've been to 5 different doctors and they cannot find the information. Well, the problem is in the mouth. And they don't have any symptoms in the mouth. But the body is talking and screaming, saying, you need to concentrate on what's happening in your mouth. So it is very important.
I'll stop recording at this time, but any other further questions we can continue?